Hi, my name is Dr. Steve Kaufman. Pain neutralization technique, or PNT, is a series of techniques that often stops pain in seconds using simple neurological or muscular reflexes. And we're going to give you a demonstration of that in just a few more seconds. PNT works by treating the cause. It's not just symptomatic, it doesn't just cover pain up, but it actually gets rid of the cause in many cases. A lot of pain is due to tender areas in muscle, and by alleviating those tender areas and by increasing circulation into the muscle, often within a few seconds we're able to resolve those tender areas. Of course, it does not work all the time. It does not work on every single patient. Not all pain is due to muscular tender areas. Not all patients respond to the techniques, and sometimes a patient will respond for a short period of time and then the tender areas come back. But in many cases, eliminating the tender areas in the muscle will eliminate chronic and acute pain. And if you read down the rest of the web page, you'll see we have about 400 testimonials at this point, and you'll actually be able to read different doctors. We don't usually use patient testimonials, but you'll see different doctors stating the results they've had both in their own cases and in the patients they've treated. The procedures are so effective that I've been invited to speak at not just numerous state chiropractic conventions, but several medical conferences as well, which I believe is a first. I don't think this has ever happened in the chiropractic profession before. There's never been a procedure that has so instantaneously proven that it could resolve a patient's problem, either acute or chronic. In fact, our procedures are so effective that we guarantee your satisfaction with them. Again, I think we're the only people in this field that are willing to do that. You can try any of our video products, buy it and try it for 60 days. If you're not satisfied, just call me up at the end of that 60 days and we'll give you a full refund minus the shipping and handling fee. What could be more fair than that? You have absolutely no risk for looking at our material. Let me tell you what pain neutralization is not. Although we do treat sore areas in muscles, which often are called trigger points, it is not trigger point therapy. We get many people call us up and say, well, this is the same as that, isn't it? Isn't this trigger point therapy? Isn't this Travail? Isn't this any one of a number of massage techniques? No, it is not similar to anything you know, unless of course you've learned it from me. These are a series of reflexes that actually turn off so-called trigger points. Our definitions of trigger points are a little bit different than standard definition. We have a much broader definition. Basically, any area of the body that's sore to pressure, we'd label a trigger point, regardless of whether it has a radiation pattern or not. But you'll see what I'm talking about in just a minute. Our procedures are not myofascial release. They're not any technique that makes use of that. It's not any kind of cranial therapy. It's not any kind of acupressure or acupuncture. It's not any type of manipulation. Most of our students are chiropractors or medical doctors or osteopathic physicians or licensed acupuncturists. We do have a few body workers that we allow to learn our procedures as well, and of course physical therapists are welcome to learn our procedures. The basic concept that we go by is that very often in a pain syndrome, when a patient has chronic or acute pain, there are areas in muscles close to or related to that pain which are sore on pressure. Again, similar to the trigger point concept. But we do not treat trigger points. We don't do any kind of deep kneading or goading. We only find those sore areas and then we use neurological reflexes to turn them off, and often they'll turn off instantaneously. Again, as I'll repeat over and over, it does not work in every single case, and we make absolutely no claim or no guarantee that it will work in any individual case. But the procedures work in such a substantial percentage of cases that we're very confident both to sell our products with a money-back guarantee and of course to demonstrate them on stage in front of hundreds and hundreds of doctors. Many of the testimonials, as I mentioned, you'll see further on down the page, and so let me just show you what it looks like, what a simple application would look like in practice.